Hello, my name is Bryn Neal and I'm a retired GP who used to work from a surgery based in the old town of Amersham in Buckinghamshire, and I was there for almost 30 years. I'm also a trustee of a newly formed charity called Chiltern Compass, which seeks to enable those who want to consider, to talk and to make plans about their death or dying. It's interesting really that there seems to be a reluctance to talk about death or dying in the 21st century as compared with, say, the Victorian times when death was much more frequent and common and therefore was talked about quite openly. The current situation that we find ourselves in, of course, is quite unprecedented in that we have a large number of people becoming quite unwell and some dying of a previously unknown infectious disease we now know is called COVID-19. This has given an added urgency to the need for us to focus on this particular topic. Hence the title of this talk, which is Dying to Start a Conversation, which we thought was quite pertinent, and we hope we will find it informative and helpful. My interest in care of the dying began when my father died of motor neuron disease in 1976. This is him, Benjamin John Neal, known as Reg to all of his family and friends. He was a proud man, and this picture was taken at his retirement, when he'd been working in a local factory running their boiler house for well over 30 years. Nobody knew why he was called Reg, none of us, and it was just one of those conversations that we never had. And we never had a conversation with him about his dying or where he would like to die. But we knew that he was terrified of hospitals, and so we kind of assumed that to die at home would be the best thing. Being cared for, albeit being cared for largely by my mother, who was in her late 70s, with a bit of help from a district nurse. He died a distressing and an unpleasant death, which lives on in my memory. Whenever I see or hear of this poem by Dylan Thomas, which was written whilst his own father was dying, it's as though it was written for my father. And I often wonder whether his loud cries were as a result of his physical discomfort, or that he just didn't want to die and was clinging on to every last breath and letting us know that he wasn't ready. More than that, though, I do feel that had we been able to freely talk to him about death and dying, it would have made the whole process perhaps more reasonably endurable for him and for us. It had a profound effect on me and my career, in that I vowed to myself that I would do my utmost to ensure that any patient under my care would not die in the same way, and I think I largely achieved that. Obviously, in my professional career, I looked after a large number of people who died of a terminal illness, and also those who died suddenly without any indication to their family or friends that they were unwell in any way. I was also involved as a trustee in a number of trusts that dealt with care of the dying, and so this helped to develop my interest further. Not talking about death or dying can lead to confusion and distress. Having somebody to talk about these issues to can make this period of your life, death being an important part of life, more acceptable and rewarding for everybody. Within this backdrop, a group of us, lay people, clergy and medical professionals, formed Chiltern Compass. It is a charity that is run by these volunteers to provide a service to help those who are seeking information or advice or understanding about the issues around death and dying. We wanted to do this by resourcing talks to community groups and professional groups, by running workshops for those who wanted to help us in this work, and by providing leaflets and books, and also a website for people to access. Unfortunately, the COVID pandemic has interrupted this, but we're trying to find other ways of communicating our message, this being one of them. Life is a gift. It's full of opportunities and challenges, but it's there largely for us to savour and enjoy. There's only one certainty, and that is that we will all die at some point. Chiltern Compass is attempting to provide support to those who want to make plans that suit them, remembering no one size fits all. We need to get rid of the myth that talking about death brings it any closer. Once it's talked about, of course, the plans are made and it's recorded, then life is for getting on with and enjoying. The benefit is that you can be free of the ifs and buts and what happens when you're gone. This next slide is a little bit old. It indicates a study that was carried out in 2012, but from our discussions it would seem that very little has changed. Only 27% of the public have spoken to a family member about their wishes, and only 8% have written it down. Only 37% have written a will. Have you? Only 35% of GPs have initiated a discussion about end of life with their patients. You might think that's surprising, but you see, doctors generally tend to be, or try to be, as optimistic as they can with their patients. And one of the traps they can fall into is that they run out of time to actually talk to their patients about it. Only 7% of GPs have written down their wishes, and only just over 50% written a will. So that's also a little surprising. But most could see the benefit of an open discussion. Of course, there'll always be those who take a philosophical approach, as you can see with this pig and hedgehog cartoon. Pig saying, "I have big plans for my life," and hedgehog replying, "Like what?" Pig replies, "Like never dying. I don't plan to die." And hedgehog says, "We have no choice, pig. We die whether we want to or not." And after a period of reflection, pig replies, "That's going to affect my other plans." What about the myths about dying? Well, as I've said, talking about it doesn't bring it any closer. That's quite obvious to most of us, I guess. Also, letting go is not wrong, and it doesn't significantly hasten the end. Natural dying is not wrong or a failure, and this is a myth that can be perpetuated in hospital. I can remember when I was a young doctor just starting on the wards, and the first patient I was responsible for that died, and I was beside myself because I assumed I must have either done something or not done something that brought about his death. No one had told me that people come into hospital and mostly come in and get better, but sometimes they come in and they die. And so it actually took me a while to adjust to that reality. You can be in control. You can talk to family, friends, those who are caring for you. You can talk to them and tell them what you want and stay in control of the process. It really is okay to share your feelings. It's not the wrong thing to do. And in fact, it can make you feel a good deal better in talking about your feelings. And then there's this last myth that everybody dies in pain, which is rarely the case these days, that most distressing symptoms, including pain, can be controlled very well. Yes, difficult conversations must be had, or they do get harder. Now, it can be quite difficult because family and friends sometimes are quite reluctant to engage in conversation about this topic. So it can be quite difficult. But let me tell you a true story. A couple came to one of our talks, and after, when they went home, they had a discussion about what each of them wanted to happen when they died. And some weeks after that, they went down to the West Country to a family party. And as the couple were going in or out of the house, I'm not sure which, the chap actually slipped and hit his head on the concrete steps. He became unconscious and was taken into hospital. And the scan showed he had a large brain hemorrhage. And sadly, he died within a few hours. His wife, of course, was totally distressed and distraught. But after that, she actually felt somewhat comforted because they'd had this discussion and she knew what he wanted. This next slide shows Dame Cicely Saunders, whom some of you may know or remember. She really gave birth to the modern hospice movement, and she helped to establish St Christopher's Hospice in Kent, which was opened in 1967. She had these words of wisdom: "How people die lives on in the memory of those who live on." And so a bad death can lead to a prolonged bereavement, and I can certainly attest to that. You matter because you are you, and you matter until the very last moment of your life. This is true, but it's not always recognised. And preparing for a good death is possible, but only if you know somebody's wishes. And there's only one chance to get it right. So what are the advantages of talking and planning? Well, for yourself, of course, there's the fact that you can rest in the knowledge that your wishes about how or where you're going to die will be respected, and that all of those post-death arrangements that you want will also be respected and carried out. I can give you an example. My wife and I have 3 daughters-in-law and 2 granddaughters, and my wife has a number of rings that she wants to leave to the girls. So she asked one of the daughters-in-law if they would like just to select which rings they wanted, and she thought the better course of action was for my wife to choose who got which ring. So we've been through the process and we've allocated the rings, we've taken photographs of them, put them away in the safe, and hopefully they'll reach the appropriate person at the right time. For your family, they'll be clear about your wishes and can be certain that they're dealing with your affairs appropriately. It can, of course, settle disagreements or even arguments. So making it clear is helpful. For your carers, they'll always want to do the best for you. They'll always want to make you as comfortable as possible. But to know your preferences is always very helpful to them. For medical and nursing staff, questions about, do you want to be resuscitated in any event, or only just in certain circumstances, or not at all? Do you want to be kept alive at any cost, or only in certain circumstances? So what is it that people die of? If we look at this pie chart, you can see the majority of people die of frailty. And the next biggest group is those who die of cancer, and then those who die of chronic disease. The interesting thing about this slide is that only 8% of people die unexpectedly. And so for the majority of us, we have plenty of time to make plans and to record our wishes. Where is it that people die? Well, as you can imagine, most people say they want to die at home. But in fact, most people die in hospital. So why is this? Well, it's partly because of evolving possibilities in terms of new treatments. And so doctors and nurses can carry on with these new treatments almost up to the point of death. But it also can be because family or friends are somewhat afraid of death, and they're afraid that they may be criticised for not doing their best for their relative. So they put pressure on the community services to dispatch their relative into hospital. Of course, the community services themselves can be guilty of the same kind of issue in not giving full consideration to the possibilities of a home death and dispatching patients into hospital. If we look at the outcomes of dying at home, if we take this first slide, this is a study back in 2004, so really quite old, but it shows that home deaths were associated with a better bereavement response and a better physical health post-bereavement. But even if you look at a later time, in this next slide, shows a comprehensive population study in 2015. And it showed there that patients had more peace during their last week of their lives when they were dying at home, and that the relatives' grief was less intense. So generally, it seems a good thing if it can be achieved. I love to look at these cartoons too, and we have here the pessimist versus the optimist. with Charlie Brown saying, "Someday we will all die, Snoopy." Snoopy replies, "True, but on all the other days we will not." Good for Snoopy, I say. Anyway, what are the practical issues? First of all, wills. Have you done one? Do you need to? Some solicitors would say if your estate is quite simple, when you don't own property, then you don't really need a will. But if you do own property, or perhaps more than one property, then most people would say that it's sensible to have a will to make things clear. You can go to a solicitor, of course, who will draw up a will for you at a certain cost. And I would mention here that there's usually what's called a free wills month, where some solicitors get together with some charities like Age UK and British Legion, and they offer to draw up a fairly simple will for free for elderly people. And this is usually around March each year, I think. You can go to a will writer who, as far as I know, doesn't have the same legal qualifications as a solicitor, but is used to writing wills. Or you can go to W.H. Smith and buy a template and fill it in. And I'm sure solicitors would say, of course, you're taking a risk there that it will hold up in the law in future times. Lasting power of attorneys. There are two types of lasting power of attorney, that to cover finance and that to cover your health and well-being. The point about these powers of attorney is that you're appointing somebody to take care of your affairs and make decisions for you over your finances or over your health. The key point here, though, is that you have to have mental capacity in order to draw these documents up. It's no good waiting until your relative starts to lose capacity, maybe through dementia or something, because then it's too late. You can draw up passing the powers of attorney at an earlier date and put them to one side and not activate them until a later date when it's required. The advance directive. Are you clear about whether you want invasive treatments or not? Do you want to be resuscitated? Otherwise, doctors and nurses will make the decisions for you. But they're not basing it on any good knowledge about what your requirements or wishes are. We look at organ donation. You can see that 90% of people asked would say that they want to have an organ if they needed it, but only some 29% have actually signed up for their organs to be used. Has been a new law enacted which has an opt-out clause now, which means that unless you say otherwise, it will be assumed that you've given permission for your organs to be used, and that may well be acted upon. Body donation. Some medical schools, or most medical schools, are very keen to receive bodies to enable them to teach anatomy to medical students and young doctors. And the upside of that is the medical school will take over the responsibility for the subsequent funeral after they finish with the body. Funeral arrangements. You may have specific wishes in terms of your funeral arrangements. You want particular songs sung, favourite hymn maybe, or the Alleluia chorus, or maybe even the Rolling Stones, Can't Get No Satisfaction. There may be other things that you want to be carried out, certain speeches, or you want people to wear certain clothes or whatever. All of these things, may be of interest to you to indicate. And then, of course, there's the bucket list, which is a list of things that you want to do or you want to see before you die. So that can be an important list for you. If we look at the transplant figures over the last year, some 6,000 people have been on the waiting list currently, and some 350 people died in the last year waiting for an organ. Now, as I've said, this may well change with the opt-out clause in the law, but I know that this law was changed in Wales some time ago, and as far as we know, it hasn't resulted in a particular increase in the number of transplants. So we have to wait and see. The only one thing that's more difficult than talking about dying is not talking about it. You can talk about it at any time as long as you can find somebody to listen. It may be a quiet time at home, or it may be just a gentle walk through the countryside. You may remember the story about Sir Andrew Strauss and his wife Ruth. This is a picture with them and their boys in happier times. Ruth died of a rare form of lung cancer on the 29th of December 2018. And the boys, she was aged 46, the boys were aged 10 years and 13 years. The idea of the Ruth Strauss Foundation came to Ruth in the last few months of her life. She wanted to do something for other people. And so as a result of this, it was possible to raise a large amount of money for research into her particular condition, and also to help support people in a similar predicament. And this no doubt gave her some further purpose in her life. This is a year later, in August 2019, when Sir Andrew Strauss was there with his at Lord's with his two boys, Luca and Sam, and they rang the 5-minute bell on Ruth Strauss Day. This was the second day of the Ashes match with England versus Australia. This promotional video belongs to the Child Bereavement Charity and is dealing with the emotional aspects of death. But of course the sentiments expressed by those talking can apply to anyone dealing with the death of a family member or friend. It highlights the importance of saying what you want to whilst you can.
If I had one more minute,
Gosh, that's a hard question.
I would tell her that I know that you didn't want to leave me alone, but it was your time to go.
I just want to tell her that I love her, and that there's not a day I don't think about her. There's not a day it doesn't hurt.
I would thank him for being a brilliant son.
I'd put my arms around her and I'd hold on and not let go and enjoy that moment.
I think the key thing I would say to him is, don't do it.
I think it would just be nice to look at her.
To see her open her eyes.
If I was able to have one more minute, I'd tell her I love her. There's loads.
I would thank her for everything she did for my boys.
It just helped to be able to know how much he did love us before he went.
I'd remind her of all the wonderful things that she'd given us. And we'll never forget her, is what I'd say to her.
I would say I love you, because I couldn't say that because I didn't have the chance to.
It'd be just to tell him how much I loved him and just how proud I am of the children and just that we're doing okay.
Nothing in life is so bad, particularly if you have support.
If I had one more minute.
One more minute.
If I had another minute, I'd be very grateful.
Child Bereavement UK gives face-to-face support to children, young people and families when a child grieves or when a child dies.
Without someone to talk to, grief can feel lonely and unbearable. Please take one more minute to support Child Bereavement UK and help to rebuild the lives of bereaved families.
Just before finishing, I'd like to acknowledge the work of Dr. Jo Withers and her colleagues at Finity, who contributed such useful resources on this topic, and in particular the End of Life Plans book, which you can access through our website. I'd also commend to you Jo Withers' TED lecture, which can be accessed through this link, and you'll hear her speaking much more eloquently than me on this topic. Thank you for listening. I'll leave you with this light note where you can see a daughter is trying to make plans for her mother. Her mother's not being very cooperative. Thank you for listening.